Hi, everyone, and welcome to the virtual series, Life After GBS-CIDP Diagnosis for Youth and Teens. I am Meg Francescangeli, Communications and Programs Associate at the GBS-CIDP Foundation International. I also have with me Dr. Diana Castro, Pediatric Neurologist at UT Southwestern Medical Center. Thank you for joining us today, Diana.
Oh, very happy to. Thank you.
Before we begin, I just want to share with you some information about our new youth, teen, and young adult program. Our YTA program is designed to provide support and education to younger patients and their families with Guillain-Barre syndrome, CIDP, or variant conditions. We will do this through providing educational content for all ages on our website, connecting young people with their peers, and creating opportunities and experiences for all YTAs to get involved in our foundation. So if you are a teen or young adult patient, I would love to connect with you, learn more about how this program can support you and other patients. So if you're interested, please reach out to me at meg.francescangeli@gbs-cidp.org. So I'd like to finally introduce Dr. Diana Castro, Pediatric Neurologist at UT Southwestern Medical Center, Global Medical Advisor, and our YTA Medical Advisor. Diana, would you like to share a little bit about yourself?
Sure. I'm a pediatric neurologist, like you said, but I specialize in neuromuscular conditioning in children. So I train extra just to work in neuromuscular issues like muscle conditions, nerve conditions, but Guillain-Barre and CIDP are very close to my heart. It's one of the areas that I really like. So I have been spending a lot of time seeing a lot of patients from different areas. I get consulted a lot through internet, and sometimes families will travel to me in Dallas. So it has been a great experience to have that possibility to have a large community. We have a lot of patients in Dallas with Guillain-Barre. So that, I think, was one of the reasons I end up being so interested about these conditions. I only see neuromuscular conditions. I don't see anything else in neurology. So very dedicated to this. I'm very happy again to be part of this, and extremely, extremely happy.
Thank you so much. Well, I'm excited to begin this session. So before we begin, I just want to let everyone know these questions that we'll be asking Dr. Diana Castro, they're questions that we've received through Facebook or other social media handles. They've been inquiries through our foundation or just parent-to-parent conversations. So that's where we've gotten a lot of these questions that we're going to be asking Dr. Diana Castro today. So just a little background information. So let's begin. So the first question is, how can children and teens explain their condition to their peers? Or what are some best practices or tips for teaching friends about their condition?
So the way I explain to the families, mostly to my patients, obviously, I say to them, I always draw it for them. And the way I say it is, imagine a cable, any cable that has a wire inside. So every cable has the wire inside, and outside has that plastic protection. So we call the cable, the wire itself, it's called the axon. And then the cover, or the plastic cover, we call myelin, right? So when I explain this to them, I tell them what was their specific type they had, because you want to know which one was the one. Did my myelin, the plastic cover, get affected, or did my wire get affected, or both of them? So that's one way to say my nerves that leave the spinal cord from my spine, all the nerves that leave from my spinal cord got affected with the condition. It is an autoimmune condition, meaning something happened to your body. Many times we cannot understand what it was. Maybe it was a virus, maybe it was a bacteria, maybe it was a stress, a surgery can happen. And your body was trying to protect you. Your immunity, I call them like the policemen, were trying to do their job, but they got confused. And when they get confused, they start also attacking our own system. So it's just what we call, that's what we say autoimmunity, because it's your own immunity causing issues inside your body. That's why we use all these therapies that we use are trying to make your immune system calm down a little bit and tell them everything is fine. stop doing, stop doing more problems. And then at the same time, we also use other type of medications where we clean the blood or we do other things. So explain it as it is a nerve condition, affects only the nerve. It is something that is not, most of the time, does not have anything to do with genetics. It's not an infection. It's not something that can get transmitted or anything like that. And I think if you guys make those points very clear, people get less worried. Because most of the times they are worried that, oh, what if I can get that because you're close to me? It is not. It's nothing that you guys did cause it, right? It's not your fault. It's not your parents' fault. It's not genetics. It's just happened, and it can happen to any of us.
That's a really great way to explain that. I know when children or teens or young adults are diagnosed with GBS or CIDP, it's hard for them to explain, especially to their peers, what their condition actually is. So that's a really great way to explain that. Thank you. So how can you tell normal recovery symptoms versus a relapse? Can you describe the recovery process and how parents should see certain things in their child when they're recovering?
I think it's the balance between not getting your eyes away from your children and letting them have a normal life is very hard. Because as parents, we obviously, something like that happened to our children and we are going to be paranoid all the time. Something may happen, right? But we have to let them continue living, and we have to control our anxiety somehow to not give them more anxiety to the children and to the young teenagers that are going through that. So one of the things I recommend to the families is keep a diary. Keep like a notes where you're saying, this is what I'm seeing in general in a week, for example. So I'm seeing that my son or my daughter fell 3 times, 4 times. And then next week it's only 2 times or 1 time. And progressively they continue getting better. So there are less falls, there is less pain, there is less weakness, right? So if we're going in that direction, everything is going in where it should be, right? If you start seeing that according to your notes, that again, you don't have to be next to your child asking him, are you okay? Are you okay? But just observation is what you really need to do. If your observations are telling you that you're starting to see new symptoms, that you're starting to see things that were at the beginning and were resolved, and now they're starting to come back, those are the things that you have to call your physician right away and tell them, you know what, something is happening, right? So anything that is new or anything that comes back after it resolved should be a reason for them to call. And I think we will talk a little bit more later about some fatigue, and I can mention some about that. We had an article this month in the, what it called, the magazine, the review, and it talks about fatigue, and I think that's an important topic also to talk about.
Well, that actually leads us right into our next question regarding sleep issues. I had a mother on Facebook just saying that her daughter is either sleeping a lot or not at all, and she's not sure if this is normal when she's going through treatment.
Yeah. So one of the things that affects a lot of the cycle is like these patients, you end up in the hospital, right? And you go to the hospital and you're getting treatment for this, being IVIG or plasmapheresis. You're getting wake up 1,000 times every night. So there is not really a nighttime, a good nighttime of sleep. And then during the day it's so busy. So their schedule already is completely affected. So that's one thing. We have to give them time to go back to when they come home, to go back to a regular schedule. So it's okay to be sleepy at the beginning. It's okay to be more tired. Then the other thing is the level of fatigue. So what level of fatigue is acceptable? I think every person has a different level, right? We cannot say this is a specific level, but we can say that as long as the fatigue continues improving slowly, then we're going again in the right direction. Are they patients that suffer from fatigue the rest of their life? Yes. I have heard adults who had Guillain-Barre 15 years, 20 years ago, and they still complain about fatigue. We don't understand yet why. So it could happen. It doesn't mean that it's going to happen to everybody. And the good thing is that for children and for young adults and teenagers, This is not as common as it is for adults. So if this happened to you where you're an adult, it's harder on your body. When it happens when you're a young child or a teenager, it usually, their body, it's a little bit more resilient. So they have a better recovery. You know, we don't see mortality as we can see it, you know, with adult people. In children, it's, let's say, that a little more benign. There is a 5% risk of getting the chronic form, the one we call chronic inflammatory demyelinating neuropathy, or CIDP. And the things that we're looking at, like I said, is if all of those symptoms start coming back and get better, or they start fluctuating, then this when we get more concerned.
Our next question that we had from a mother on Facebook was, her child stopped growing once he was diagnosed or started with the treatment. Is this something that can be expected with children with GBS or CIDP?
It's something that is not described, at least not in children, not in our population, because there is not a specific, nothing that it's affecting specific areas in the brain for growing or in the bone for anything like that, right? Could it be there are some specific and more special cases where the origin or the cause of the Guillain-Barre was related to some kind of surgery, or, you know, something completely, you know, special? Yes, could be. Everything can happen in medicine. I always tell my patients, I think that as physicians, we have to listen to the patients. We cannot just say, oh no, it has not been described, so it doesn't exist. I'm just saying, I listen to it, but in general, I have never heard and I have never read anything related to growth. So that could be a specific case, a special case. Should they be looking into other options, other things that could cause the problem? Yes. I think that because it's not typical presentation, they should be looking into something.
Okay, thank you, Diana. So the next question has to do with vaccines, and I know this is a very popular question. So an example that I picked was from Facebook, a mother and her child. Her child was diagnosed at 3 with GBS, and he recovered pretty fast. He is now due for his 4-year-old checkup and shots. Should she be worried about him having vaccines, or should there be an estimated amount of years that vaccines should be given? I know with schooling, there's certain shots that you need for elementary school, high school, and college.
You should be giving all the vaccines to your children, all of them. Why? Because the risk of having one of those conditions is going to be higher, and the complications are going to be way worse than could be really with Guillain-Barre. So what I recommend always is, I understand from their perspective, they are worried, right? This happened, and what if it happens again? So one thing that we come to an agreement is like the 4-year-old vaccination. I think they received 3 of them, I believe, if I'm not forgetting my basic pediatrics. But what I said is, okay, you can give them one and then wait for 2 weeks to give them the other one. That is an acceptable option as well. If that's going to make you feel a little better, and it's likely, you know, it's just not going to have any impact anyway. But just from the mother's perspective, I think that it's okay. It's not okay not to give it to them. It's okay to space it out a little bit. The other point is about influenza vaccine, because when you're going to get the influenza, the first thing they ask is, have you had Guillain-Barre? So if that is in the formulary that you're filling out and you had Guillain-Barre, you're going to say, should not be getting these vaccinations. And that's not true. Most of the cases, again, we don't know what the cause is, unless what I call the temporal relation, unless there was temporal relation with the vaccine and Guillain-Barre, meaning you got the vaccine and a week later, let's say you got Guillain-Barre, I'll be probably more careful with that patient. But if it doesn't have anything to do with the vaccine, everybody should be getting the vaccine.
Okay. All right. So that's good to know. I know I've seen that a lot out on social media, and also inquiries that we've been receiving through the foundation. Everyone's always concerned about vaccines, rightfully so. So that's a really great answer. Thank you. When a child is diagnosed with GBS or CIDP, what are some ways parents can help their child understand what is going on? Just because it can be such a scary and confusing time from them, how can parents just get their child to understand what's happening to their body?
You know, I think the first thing is that you have to explain to them, like with the first question you asked me, try to make it simple for them to understand what happened. These policemen went crazy and they start attacking their own system, their own nerves, right? No, it wasn't their fault. First, you have to take that from them, because usually there is a lot of guilt, of no reason, there is guilt. And then after that, kind of giving them a general timeline. And that's something that the physician can help you, giving you a general timeline. It doesn't mean that that's a specific case for that patient, but it's in general. Most kids will recover within 2 months, right? Most kids will do very well. And there are some of them that are going to continue having some level of weakness, some level of fatigue or pain, but that progressively will continue getting better and better. So if you put it in perspective for them, it may help them understanding. Depression is something that I don't think physicians, we don't do a good job in children, treating them. And over the last year, I personally have been more dedicated to start patients on medications, to start them on counseling, to help them with depression, because this is a really big hit in their lives. Many kids are absolutely active. They love to play, they love to jump. Some of them are athletes. You know, many of them have been practicing to go to college with scholarships, and suddenly this happened. So you cannot forget mental health. I think that's another way that the parents can help, is do not deny that for them. Try to find a counselor as fast as you can, and find a counselor that is also going to help you as family to deal with the situation.
Such a challenging time, and to just be able to talk it through with someone, that can be very helpful. I hear a lot of children getting diagnosed a second time with GBS. Why does this tend to happen with certain children?
You know, Guillain-Barre is supposed to be monophasic, but like I say, medicine is not perfect. Nothing is 100%. So have I seen patients that had a second episode of Guillain-Barre and never had anything else in their life? Yes. But could that be your first relapse for CIDP, and then later on you may develop another one? Yes, as well, right? So it's a difficult question. So it can happen, but it's rare that you're relapsing. You always have to be very attentive of maybe another relapse may happen later on. So my answer will be yes and no in that case. One of the things that I'll probably will go ahead and talk right now, it's about genetic testing. CIDP is a very difficult diagnosis. It's extremely difficult in adults already, as imagine how difficult it's going to be in children. So in my case, what I have been recommending is that for my children with CIDP, I'm doing genetic testing, at least testing for the basic causes of genetic neuropathies. So there is something called Charcot-Marie-Tooth, that it's a type of neuropathy that comes through the genes, that it can happen. And unfortunately, some of those can happen suddenly. They can look like Guillain-Barre. They can look exactly, and they may even respond a little bit to IVIG. But then the patient will never come back to normal, or the patient will start having these supposedly relapses. So I think that thinking about genetic testing, if things are not going in the right direction, it's appropriate for some of these patients.
Great. I mean, that's just great information to have for our parents, and as well for the foundation as well. So we will end our session just with an open-ended question for you, Diana. Is there anything else you would like to share to parents or teens or young adults about being diagnosed with GBS or CIDP?
You know, the only thing I ask is ask questions. Ask all the questions you can. You should get all the answers you need, because you're the one who is dealing with this. So you should not be afraid of asking why this happened to me. Could we do something different? Do we need to do something different to get me better faster? So do not hold onto anything. Get to your physician and ask all the questions. Teenagers tend to be, they're very strong and they're strong-minded. And sometimes they don't say anything to their parents because they don't want to say anything to their parents. You know, I develop a very close relationship with my teenagers. So sometimes they even tell me and they don't tell their parents. So that's okay too, right? So it's okay if you go as a teenager or a young adult and you want your parents outside, your physician should be asking them to step outside. You should have that time in privacy that you can ask your questions. So keep asking because there is always, nothing is a perfect answer. There could be something else there that can help.
Well, thank you so much, Diana. This session was wonderful. I hope that everyone had some questions answered. And if you have any questions, feel free to email me. I'm happy to help you find an answer, help you find the right doctor to speak to. So this is the end of our session, and be sure to check back right here on our Ask the Experts page for all of our Ask the Experts interview. So thank you so much, everyone. I really appreciate you watching, and have a great rest of your day.